The premise of the study is that 1 in 10 children has a diagnosis of asthma in Canada. And for many children, this can be associated with emergency room visits. A proportion of children, about 25% of kids who come to the emergency room for asthma, will actually have a repeat visit within the same year. And we know that these visits are in fact preventable if we are able to provide the right types of medications at discharge, and most importantly, comprehensive asthma education. The goal of this study is to actually develop a tool or a way of identifying children who actually are most at risk for coming back to the hospital for a second or repeat asthma emergency room visit or hospitalization. We can then use statistical techniques to develop a tool or a way for frontline emergency room physicians to then identify these high-risk children and apply targeted preventative interventions just for those children who really would benefit most. If we are able to develop this prediction rule or tool for emergency room healthcare providers to use, we should be able to prevent subsequent emergency room visits for asthma or even hospitalizations for asthma for these children. That would result in a significant reduction in health resource use, but most importantly, help the lives of these children and families who are missing time off school, missing days of work, and having significant negative quality of life because of difficult to control asthma. The most rewarding part of what I do is interacting with patients and families, seeing children who come to me with sometimes a lot of respiratory difficulty, a lot of symptoms of difficulty breathing, cough that keeps them from playing sports, and watching as we initiate treatments, conversations, start our therapeutic alliance, seeing them improve and suddenly be able to participate in sports and come back and tell me that they just tried out for a sports team, whereas 6 months ago they weren't able to walk up a flight of stairs. That for me is just incredibly rewarding.